So thank you, everyone, and apologies for the delay. We're ready to start our closing ceremony. We do have all our dignitaries and panelists ready. And so without wasting any more time, I will call on Prof. John Ataguba, who is our incoming AfHEA Executive Director, to give his remarks. John.
Thank you very much, Amma. Good afternoon, good evening, depending on where you are, or good morning, and then depending on where you are. The Permanent Secretary, Ministry of Health of Rwanda, Mr. Yakarimye Zachi, I'm the Chairman of the Board of Trustees of the African Health Economics and Policy Association. I'm Dr. Tanya Misuma Leju. I'm the President of International Health Economics Association, Professor Audrey Laporte. I'm the Executive Director of the International Health Economics and Policy Association, Professor Dai McIntyre. The outgoing Executive Director of the African Health Economics and Policy Association, Dr. Chris Ati. Partner representatives of AfHEA, all AfHEA's individual and institutional members, and all participants to this 6th AfHEA conference, distinguished guests, all protocols duly observed. I'm pleased to be talking to you on this last day of our first ever virtual conference. The past 4 to 5 days have been packed with exciting presentations, speeches, engagements, and discussions. When the decision was taken to host the conference virtually, I was a bit scared about the number of participants who would register, mainly because this is a road that we've never traveled. As it turned out, this year's conference was a huge success. Colleagues, together, we conquered the COVID-19 pandemic. AfHEA as an organization has grown tremendously over the past years and remains a significant regional player. At the formal birth of the association at our first conference that held in 2009 in Ghana, AfHEA was fragile. However, in 2019, when we hosted a conference back again in Accra to commemorate a decade of inception, AfHEA had grown strong and attracted significant dignitaries from across the globe. I remembered personally meeting the late Professor Adam Wagstaff in person for the last time in Accra at our conference. Our biennial, or let me call it quasi-biennial conferences, became really a meeting place for many of us, and it facilitated collaboration between researchers, policymakers, and the press. The themes or foci of our conferences resonate clearly with the needs within Africa. The inaugural conference's theme, for example, was about setting health economics priority in Africa. After that, universal health coverage and the post-2015 agenda took center stage. And here we are this year, and our theme was just about moving towards resilient health systems in Africa with a focus on the role of health economics and policy research. There is no doubt that the current COVID-19 pandemic has complicated many things, including exacerbating existing pandemics, i.e. poverty and inequality. The aftermath of the pandemic will undoubtedly remain with us, and we have a duty as health economists and health policy experts to contribute towards alleviating people's plight. Importantly, this year's conference's sub-themes allowed us to discuss what we have learned from the COVID-19 pandemic and prepare for future pandemics of similar nature. We had several presentations spanning different aspects of health economics and health systems research and policy. It really warms my heart to see colleagues' enthusiasm for this conference, and I really, really hope that this will continue in the future. Like each of our past conferences, I really hoped that this year's offering met your expectations, that it will impact your career favorably. I also hope that we I leave this conference with significant experiences and knowledge to provide evidence-based solutions to the many challenges facing Africa, including but not limited to the current COVID-19 pandemic. Africa, we all know, continues to bear a more substantial burden of disease than any other continent. And it is our responsibility collectively and individually to contribute to making the continent a better place. In doing so, we must internalize the SDG mantra of leaving no one behind. I am really excited that many early career researchers attended this conference. There are enormous potentials for early career researchers, including postgraduate students, to make significant impacts. As we advance, AfHEA will ensure that the needs of this dynamic and vibrant population are continually accommodated and addressed. We will be rolling out many activities that early career researchers can lead, so you must watch the space. We will use the affordance of digital technology made more pronounced by the COVID-19 pandemic to reach more members in profound ways. Let me use this opportunity to express my profound appreciation to Dr. Chris Atim, a strategist and a strong and visionary leader. As a pioneer executive director, Chris grew and developed AfHEA with support from colleagues. We would not be here without his insights and visionary leadership. He placed AfHEA on a pedestal to become a solid regional association of health economists and policy experts. Dr. Atim, let me assure you that your vision and legacy that you leave for AfHEA will live on. AfHEA survived difficult times, including this COVID-19 pandemic, because of your leadership. I remembered how we had to push to organize this year's conference. The conference's format was unclear and was really a moving target, making it difficult to plan and set things in motion. Yet we did it. Here we are now at the end of that process. Thanks to you and to everyone who accepted to participate in this conference virtually, despite all the challenges associated with virtual conferences. We are hoping that conditions for future AfHEA conferences will allow us to meet in person. Whatever be the case, the pandemic has taught us a lot, and we have become more resilient and willing to adapt to changes and take on challenges, including taking into consideration the affordance of digital technology. As the incoming executive director of AfHEA, I want to assure everyone that AfHEA will continue to ensure equity, diversity, and inclusion. Our members' voices shall guide our path because we are a membership association. We shall invest in growing our membership across all the regions in Africa. AfHEA is here to serve its members, and I will encourage everyone to reach out to us. Please let us know how best to serve you. As noted before, we shall be looking into innovative ways to serve our members, especially our early career researchers and also policymakers. For example, the number and quality of research papers emanating from Africa remain a challenge that we shall try to address as best as we can. After listening to presentations at the conference, I will add that the quality of our research is indeed increasing. We also need to improve interactions between members, as we can use the AfHEA platform to hook up researchers for collaborative research grants on the continent. So if you're applying for a research grant and need collaboration from certain parts of the continent, for instance, please reach out to us and we shall gladly assist with the hooking up process. I want to thank our benefactors, including the Bill and Melinda Gates Foundation, the International Development Research Center, IDRC, the World Health Organization, and the UN system, including UNFPA. Also, allow me to thank the scientific committee co-chairs, Dr. Amafeni, Professor Mustafa Thiam, and all the scientific committee members, including the AfHEA executive and staff at our offices, and everyone along the chain our interpreters inclusive. They have worked tirelessly to bring this conference to fruition. I look forward to welcoming you in person to Rwanda at our next conference. Thank you very much and have a great day.
Thank you very much, Prof. Asaguba, for such wonderful words to us. At this point, I will call on Prof. Justice Novinyo, who is going to give us a message on behalf of Africa CDC. Thanks.
Thank you very much, Dr. Finney. Colleagues, the Permanent Secretary of the Ministry of Health, Rwanda, the Board Chair of AfHEA, the outgoing Executive Director, Dr. Chris Atim, and the incoming Executive Director, Professor John Ataguba, the Executive Director of the International Health Economics Association, Prof. McIntyre, all other protocols observed. Indeed, as a founding member of AfHEA, one who was there in Accra in 2009, and before then saw how, many people, including Chris, had to toil to birth such a noble association, and one who has seen AfHEA travel through these years. I cannot but to say a big thank you to everyone involved, especially to Dr. Atim for your vision and for bearing us through. Colleagues, over the past 2 years or so, the COVID-19 pandemic has taught us a very bitter lesson. One that many of us who have spent, our working lives in the area of economics and health really knew, but one that has actually brought the ears of policymakers in the health sector, but also in the finance sector, the ministries of health, and even at the presidency, the very high levels of society, closer to us. We now have an opportunity to drive the agenda for health economics on the continent. We have an opportunity to...
Bonsoir. Non entend plus les interprètes.
We have an opportunity also as a society to expand, some of the work we've been doing. For instance, you do know that Africa CDC is the continent's foremost institution that drives the agenda for strong and resilient public health, emergency, laboratory, and surveillance systems that not only protects and prevents the continent's population from diseases, but also helps us control the current diseases. However, the area of work that the Africa CDC works in terms of public health emergencies, surveillance, laboratories, and systems have received relatively little work in terms of the use of economic tools to help us explore these areas. So I call on colleagues, AfHEA members, health economists, to begin to rethink how we could open up this space in terms of research. And I also call on funders to begin to open up this space for us, because for us in Africa, it is an area that will stay with us for a long time. Let me end by saying that Africa CDC Health Economics Program is a relatively new program that the Africa CDC has set up. And the aim is to really bring economic evidence to the fore of decision-making at the highest levels of public health on the continent, but also to guide countries to ensure that decisions that are made are actually evidence-informed. The Africa CDC Health Economics Program would stand with AfHEA and with all other groups and networks that seek to champion an African-led, contextually feasible agenda for health economics and financing and policy research on the continent, because we can drive our own agenda on the continent with the support of partners. And so let me assure you, incoming Executive Director, that the Africa CDC stands very firmly with you. We will explore other ways of working together with partners to see how we can all use the brands to harness the needed resources to support capacity strengthening for early career researchers across the continent, whether they are master's students, PhD students, or other early career researchers in health economics. We will also stand with you to mobilize some of the resources, some of the research evidence, that are undertaken by AfHEA members, and work together to channel these into policies at the very high levels of our continent, at the AU level, but also at the regional levels and at country levels. Let me end again by thanking Dr. Chrysantheme very well and wishing him the very best, hoping also that he doesn't go too far, but sticks close by to help us as we move the agenda for health economics and policy on the continent a step further. Thank you very much for your attention.
Thank you very much, Prof. Justice Novinho. Thank you that you have still held high the flag of AfHEA, even at Africa CDC. Thank you very much. Now, I would like to call on Mr. Oliver Chinganya to give his remarks on behalf of UNECA. Thank you very much, Oliver.
Thank you very much, Madam Moderator, and may I ride on the existing protocols. And good afternoon, good morning, and good evening in some cases, depending on where you are. Let me start by first thanking the organizers of the Africa Health Economics and Policy Association for inviting the Economic Commission for Africa for the 2022 Africa Health Economics and Policy Association Conference. We are indeed delighted to participate in the closing session of this August conference. ECA and AfHEA have a common agenda of improving the health outcomes of Africans by promoting high quality and standards in the generation of policy relevant evidence and promoting the use of appropriate health economics policy and financing tools within the health sector in Africa. Let me also applaud the association for selecting such an appropriate theme, which I quote, towards resilient health systems in Africa, the role of health economics and policy research, which speaks to the realities which the world is currently facing. We are confronted with COVID-19 pandemic, which is ravaging our core assets, that is in the human capital, by increasing the mortality and morbidity burden, pushing up poverty levels, disrupting economies, and upending people's normal lives. We are not yet out of the woods, so to speak, as there are conjectural indications of an impending fifth wave. For example, at the beginning of January, the health minister in South Africa warned that COVID-19 fifth wave is likely to hit South Africa in winter or even earlier. However, the world has adapted to the situation and new methods of working have been devised, including working arrangements, conducting of meetings and conferences, which are also being held virtually, including this particular conference that you've had for a couple of days. The speakers before me, even during the conference itself, have reiterated the COVID pandemic being really overwhelming the health system, not just in Africa, but globally, and more, of course, more severely in Africa, which has the weakest health systems in the world. Vaccine distributions and access have been tilted against Africa, more in favor of developed countries which produce the vaccines and can afford them to prioritize for their own populations. As ECA, we share our concerns, as the association does, about the vaccine equity, vaccine hesitancy, and vaccine uptake in Africa. COVID-19 has impacted on several sectors, has also not spared the data statistical system, or may I generally just say the data ecosystem, which really has also been severely affected. For instance, in some countries, censuses and surveys have been canceled or even postponed completely, on account of COVID. And this has really created the issue of data being much more worse than what it is in all areas. So while COVID-19 shock has shown the vulnerability of the national statistical system, on the other hand, it has also brought or come with what I would call opportunities. It has shown the importance of data science to build forward better, more resilient health systems, and equitable accelerated towards our shared global goals. As statisticians, our fundamental role is to provide data for health economists, so that they come out with programs that improve the efficiency, effectiveness, value, and behavior in the production and the consumption of health, as well as healthcare. Data and analytics have the power to transform ideas into action. Health interventions and programs must be accountable for the results, but that accountability can't come if we don't have underlying data systems. I wish, therefore, to applaud you for the acknowledgement that data and statistics are essential in the field of health economics, as we've had a whole session devoted to the role and use of data and evidence for policy decision in the pandemic. The opportunities offered by big data potentials, for instance, in health economics, need to be explored and utilized in the digital era. According to the study that was done by Ikinabe in 2018, and I quote, it says that despite the prevailing challenges and limitations in Africa, there is evidence that big data analytics has the capacity to transform healthcare systems in Africa. Preliminary applications in the public health system, especially when epidemics happen, is proven evidence of its potential benefits in the African health system, end of quote. This is a field we need to explore together so that data from diverse data sources can be enabled, mined, and transformed in a useful, actionable knowledge. At AfHEA, we have seized the opportunity to have an initiative on the transformation and modernization of statistics through the big data and digitalization in Africa. Let me conclude by, first of all, again, to thank the Health, Economic and Policy Association and also the African Union on the collaboration with AfHEA regarding the research on the project, namely the inequity in the COVID-19 vaccine rollout and implications of Africa, a call for a multi-sectoral action. This research aims to reduce inequity in the manufacture and rollout of the COVID-19 vaccine through a combination of research, advocacy, and capacity building related activities in Africa. We look forward to a deeper collaboration with the Africa Health Economics and Policy Association. And now that you have a new executive that is coming in, we look forward to have, fostering that relationship much deeper in other areas, including what you have already started on, basically beyond this work that you're doing. We're looking forward to working with them very closely. So as AfHEA, we're conveying, we would want to use our conveying role to ensure that we reach out to all African countries and be able to really reach out and ensure that whatever the outcomes are from this particular conference, we are able to begin to work and implement on them as expected. So I'm hoping that this is the beginning of a well-natured, if you like, a well-natured and a fruitful collaboration, and looking forward really to working with yourselves. And I want to end here by thanking everyone that is part of this. Thank you very much.
Thank you very much, Mr. Chingania, for these wonderful remarks. And we're also very much looking forward to our future partnerships with UNECA. Now, I'd like to call Ms. Chinwe Obona, who will give us a few remarks on behalf of UNFPA. Thank you.
Thank you very much, Ama, for the introduction. Allow me to also please stand on existing protocols in the interest of time. And as John highlighted at the beginning, we have come full circle from Monday when we had the opening ceremony and through the days until this evening. And I'm sure, like every other person, we have taken away critical reflections on what is possible and what more do we need to do in Africa. So on behalf of UNFPA, the United Nations Population Fund, we are pleased to have been part of the conference through our partnership with AfHEA, both as participants as well as organizing a dedicated session and a plenary session to advance and enrich the body of evidence that are required, and as well all the extended partnerships that we have brokered during the process. The rich conference content, I believe, guided this meaningful evidence-based engagements. And I join previous speakers to applaud AfHEA and the scientific committee under your leadership, Ama, for doing such a great job. For us as UNFPA, we had people participating from our headquarters to almost all our regions from countries. And we had government partners also that we encourage to participate, and everybody gives kudos to AfHEA for the rich content that cut across a lot of areas. For us, we looked out for issues around population and development, sexual reproductive health and rights, gender equality, youth development, all the things that cut across our mandate. And indeed, we were pleased with the body of research and the engagements coming forward. As UNFPA, towards the SDGs, we remain committed to working with AfHEA towards generating evidence brokering, policy dialogues, increasing investment, sustainable financing, towards ending unmet need for family planning, especially addressing the high numbers of teenage pregnancies that we have on our continent. These are young girls and young women that are productive workforce, and so we cannot turn away from them. Similarly, preventable maternal deaths, we must end preventable maternal deaths and also end gender-based violence. Increasingly, we're seeing femicide creeping in a lot of countries, and that cannot be acceptable. We still see child marriage and AfHEA continues to generate evidence and put it out there across a lot of these areas. So I just want to share 3 quick reflections, and some of them will be quick in underscoring what some of the previous speakers have said. One is around what Oliver, my brother, was just saying and elaborated. I couldn't agree more, Oliver. There's need for us to scale up the availability and culture of use of evidence, including big data, at the pace and at the scale that matches the urgency. 2030 is less than 8 years. We're March 2022, so definitely less than 8 years, and the clock is ticking. So the scale and the pace of acceleration is critical for us to achieve the SDGs and the aspirations of Africa Agenda 2063, the Africa we want. So AfHEA has a lot more role to play going forward. The other, as underscored by both Oliver and Justice, is about building forward better. And I just want to highlight the need for rights-based and gender-responsive resilience building. We cannot go through this cycle again, and where we are caught unawares. So I believe that Africa needs to be primed, innovate further, rethink strategies, look at our systems, look at our approaches, our structures, all the fragility and vulnerabilities that were exposed in the past 2 years. We need to use that, like Oliver said, as opportunities to make sure that we're not leaving anyone behind. And so we not only see COVID, but also we see climate, increased climate action on our continent that continues to impact health systems, education systems, water and sanitation, the economy. So it's very important that the whole notion of resilience building, a lot more research, a lot more conversation. What does resilience building mean for Africa? And AfHEA has a role. Similarly, for deepening inequalities that our women and the youth are most disproportionately impacted upon. So what does this mean, and what must we do so that we're not caught unawares going forward? The last third area is AfHEA is doing brilliantly well in brokering partnerships, but we need to do more. Like we know that in the spirit of Ubuntu, we need to go far together and go farther such that we're closer to where we want to be. AfHEA has a brilliant vision, AfHEA has a brilliant mandate, and has a brilliant business model. So it's very critical for us to expand that. And I make a plea for the young people. I make a plea for Africa's vibrant youth, because they are tech savvy, they are connected like never before, they're young innovators. AfHEA needs to expand the partnership beyond the young researchers that are increasingly becoming AfHEA's membership, but those that are outside it. Young people in Africa across their diversity it's a gold mine for AfHEA. So like they tell us every time, nothing for us without us. So we need to pay attention, deliberate attention to expanding that partnership with young people. And I also cannot end without extending a personal thank you to Dr. Chris Atten, the outgoing executive director of AfHEA. As a founding member as well, I think there's a coalition of us around the table today Chris, I want to say to you that that vision you birthed in 2009 with a lot of people, you were able to bring together a lot of people across a vision that has been nurtured into maturity under your leadership. We applaud you, we thank you. And like Justice said, you're not going that far. So we suffice to know that you will be always available to serve, like you always challenge all of us to serve. So as a member of AfHEA, we know that we can count on you. And also join in welcoming Professor John Atagoba. John, indeed, your track record precedes you as being able to take over the mantle from Chris, and it gives us confidence that indeed AfHEA is in good hands, and we will be there to support you on behalf of UNFPA and on behalf of the women, adolescents, and young people. We stand ready to be able to work with you in the coming years. Thank you very much.
Thank you very much, Ms. Chinwe Ogbonna, for such deep reflections. We are very grateful for our partnership with UNFPA over the years. Thank you very much. At this point, I'd like to call on Prof. Juliet Nabionga to give her remarks on behalf of WHO Afro.
Thank you so much, Emma. And again, allow me to observe protocol as listed earlier. And ladies and gentlemen, it's an honor for me to be part of this very well-organized conference. And I wish to congratulate the local organizing committee, both in Rwanda and the AfHEA Secretariat, for this very successful conference despite challenges. The conference theme we had this time around, which is towards resilient health systems in Africa, the role of health economics and policy research, captures the aspirations of all countries represented in this conference. And this conference comes at a time when countries are making strides in recovering from the COVID-19 pandemic. Ladies and gentlemen, the COVID pandemic, as we all know, was not only a health crisis, but also an economic crisis. Governments all over the world were put in a position of having to trade off health with livelihood through the public health and social measures that limited economic activity. The combined economic and health impact of the COVID-19 pandemic point towards the strong likelihood of a significant worsening of financial protection and hence affecting countries' progress towards universal health coverage. This being the largest gathering of health economists and policy practitioners on the African continent provides us an opportunity to reflect on whether our toolkit as researchers, academics, policy makers, practitioners remain fit for purpose in addressing the challenges we face with COVID-19. And I believe the conference theme is a call for self-reflection for health economists and policy researchers in Africa. The scope of issues addressed in the presentations across the various sub-themes of the conference and the quality of research shared gives me hope that African researchers and African institutions are ready to contribute towards more resilient and adaptive health systems. The role of AfHEA in achieving this is worth appreciating. With the association being 12 years old, having been founded in 2009, we've seen a significant growth, not just in membership, but also the quality and the quantity of research presented on the different biennial scientific conferences. And we thank all the partners who have supported AfHEA in achieving this. It's my expectation that this conference will not only provide researchers with the opportunity to showcase their research, but even more important, inform policy and practice and efforts in building resilient health systems, and also prepare us to face the challenges of tomorrow. Beyond the biannual scientific conferences, AfHEA has undertaken commendable efforts in building research capacity on the African continent. And here I want to note the scientific writing workshops that have been held to support young researchers publish their work. And we need to continue supporting this effort. As the World Health Organization, Africa Regional Office, we remain committed and we pledge our continued support to strengthen health economics capacity and evidence generation to support our member states to move towards universal health coverage. And we believe AfHEA shares in this aspiration That provides us with a common platform for our continued strong collaboration. And as I close my remarks, I want to really appreciate the work done by the outgoing Executive Director of AfHEA, Chris Atim. We've come so far because you made the sacrifice. You've been there, you've invested selflessly, and we want to honor you and appreciate you. And as other speakers have said, the ones who spoke before me, that we still need you, but maybe in a different capacity, advisory capacity, but please keep close to us. We still need your words of wisdom. And a very warm welcome to Professor John Ataguba. We'll really support you in all your efforts, and will continue to support the work of AfHEA. Ladies and gentlemen, I thank you so much.
Thank you. Thank you so much, Prof. Juliet Nabionga. You have been such an inspiration to all of us, and we thank you for your continuous collaboration with AfHEA. At this point, I would like to share in collaboration with Prof. Thiam, who was also the co-chair of our scientific committee, the key messages that have come from our conference over the past 5 days. We may not be able to capture everything, but we will highlight some of the things that we have all discussed and reflected over the past 5 years. Allow me to share my screen. So I will call on Prof. Thiam to start the reflections. Prof. Prof. Thiam, are you able to hear us?
Attendez, je suis en train de voir. Oui, vous m'entendez, oui?
Yes, please go ahead.
Hein?
Prof. Thiam, please go ahead with the presentation.
C'est Anna? Donc, je pense que les messages clés que nous avons retenus au niveau de cette conférence, bien entendu, c'est d'abord une adaptation à la résilience. Deuxièmement, également aussi, nous avons pu remarquer également aussi que les systèmes de santé dans certains pays également aussi ont été largement combattus par la COVID également aussi, disons, à tel enseigne que même les programmes qui ont été élaborés dans certains pays n'ont pas vécu. Ça, c'est le problème également aussi que nous avons rencontré. Comme troisième élément également aussi, comme message clé que nous avons tiré, c'est qu'également aussi les systèmes d'évaluation également aussi n'ont pas pu être mis en place au niveau de certains pays, ou même si dans certains pays aussi, ça a été mis en place, mais ça reste encore. Troisième message également aussi que nous avons retenu, c'est que dans certains pays également aussi, la pandémie a été l'affaire au plus haut niveau. Il y a même dans certains États où par exemple, l'autorité suprême s'est passée de l'Assemblée nationale pour gouverner par ordonnance, comme on dit. C'est le cas, par exemple, du Sénégal. L'Assemblée nationale a autorisé le président à prendre des mesures par ordonnance. Donc, ce qui veut dire que ce sont donc les messages que nous avons pu noter à travers ça. Voilà, je pense que c'est ça le problème. Voilà. Bon, maintenant, je pourrais peut-être profiter de l'occasion pour bien entendu, poser la réflexion sur un certain nombre de points, à travers, bien entendu, les interventions de Mme Ogbonna de l'UNFP, Juliette, également aussi, surtout de Olivier. Donc, je pense que maintenant, AfHEA pourrait peut-être essayer donc de faire une étude comparative à la résilience avec la même méthodologie et ça pourra permettre, avec bien entendu l'appui du FENIAP, l'appui également aussi de l'OMS, pour voir comment les pays ont pu résister, chacun en ce qui le concerne, face maintenant à la pandémie. Donc, je pense que la réflexion pourrait se faire et surtout encourager les jeunes chercheurs qui seront encadrés par nous les vieux, comme on dit, et ça pourrait peut-être être une très bonne chose aussi pour notre association AfHEA. Parce que je rappelle également aussi que moi, je suis l'un des membres fondateurs, des premiers fondateurs. Je me rappelle, c'était à Brazza, avec Chris Hatim, dans les années 98. Donc, nous avons fait naître le bébé et je pense que maintenant, les résultats que nous avons obtenus sont vraiment satisfaisants. Voilà donc quelques éléments de réflexion que je tenais à dire à ce niveau-là. Surtout maintenant, surtout la réflexion, si on pourrait faire une étude comparative de tous les pays africains, bien entendu, face à ces résiliences. Voilà, merci. Merci beaucoup.
Thank you very much, Prof. Thiem, for your remarks. I also want to share some of the key quotes that I found and several of you found very memorable from our conference. There are just 5 of them that stand out, and I just want to mention them in closing. The first one says, data is key and everything else springs from this. The second one says, there's need for homegrown data solutions in Africa. Data is important in telling the story and ensuring robust analysis. Let's demystify the collection and analysis of data. And finally, information without data is just an opinion. Thank you so much, everyone, for sharing your memorable quotes with us, either by Twitter or through our chats. At this point, I'd like to end this session, and we will continue to reflect on everything that we have heard and shared in these past 5 days. And a special thanks to Prof. Thiem for your support throughout our collaborations, and we know that you will continue to support us as we go on. At this point, I'd like to call on Mr. Ali Kibwika. Mr. Ali, I want us to acknowledge him. He was one of the founding members of AfHEA. He has served on the board of trustees ever since AfHEA was introduced to the public. He has been renominated to serve on the current board. He has also been very instrumental in drawing up AfHEA's constitution. So Mr. Ali Kibwika, as you come here to say thank you, we want to say thank you so much for the many years you've invested in AfHEA. So I will call on Mr. Kibwika to give us the vote of thanks on behalf of AfHEA's Board of Trustees.
And thank you all those who are participating in the hosting ceremony. Thank you, Amma, for those kind words. Yes, it's been a long time. First met in Brazzaville, actually. AfHEA started in Africa, the first conference, but we started in Brazzaville as a side meeting to the WHO, which is the Rex in Africa. It's been a long time, but you know what? way thank everyone who has been there for AfHEA up to this very moment. My task, my humble task, and the honor is to move a vote of thanks. And I will definitely start with our hosts for this conference, the Republic of Rwanda. They know themselves as the heart of Africa. We want to thank them very much for all the efforts they put in the preparation for this conference. Somebody pointed out, it's been a moving target. So the Honorable Minister of Health of the Republic of Rwanda has been there with us, Dr. Daniel Ngamije. We thank you very much for all the efforts and the support you have given to us. The Permanent Secretary, Mr. AfHEA2022, of course, the head of Department Planning, Health Financing and Monitoring and Evaluation, Dr. Pafe Warirai, and the Director of Planning and Health Financing, who is with us at this closing ceremony. Plus, all the ministry officials who, in one way or the other, supported us in hosting a very successful conference. We want to thank the principal, College of Medicine and Health Sciences, Professor Jean Kabwiza, and the Dean of the School of Public Health, Dr. James Umusa, for the efforts again in supporting this conference. The Rwanda Convention Bureau, who made all the preparations for us to hold the conference in Rwanda, we thank you very much for your support, and we ask that this support should continue. You gave us a lot of support in the planning of the conference, and even at this last moment, you are still supporting the conference. Our partners, the International Health Economics Association, led by the President, Professor Audrey Laporte, and the Executive Director, our own Professor E. McIntyre. The Bill and Melinda Gates Foundation, you have been there with us, and Dr. Logan Renzel, you've been a pillar to AfHEA. The International Development Research Center, through Dr. Igambire, you've been there and you continue to support us. We thank you very much. The World Health Organization Region for Africa, we thank you very much. UNFPA, SPAC, AHOP, UNECA, and Africa CDC. Thank you for your financial, material, and technical support, as well as the institutional collaborations. We want to thank all conference participants. It's not been easy. It is much easier for one to walk into a conference and spend 3 or 4 days at some place. But it's really a task for you to be in your workplace or in your home and attend this online conference. So we thank you for the commitment, for your time. We hope that we made a difference in your life. Led by the co-chairs, Dr. Amar Feni and Professor Mamadou Yam, thank you very much for the work done over a whole period of 1 year in preparation for this conference. The rigor that you exhibited in going through the presentations and deciding on which ones to come shows in the results that the conference has achieved. I want to thank the Board of Trustees led by our indefatigable Dr. Tanya Saum Leju. Thank you very much. The job well done. The Vice Chair, Dr. Jane Chuma. Thank you for the guidance and advisory support throughout the year and during the conference planning and implementation. The Executive Committee, led by our outgoing Executive Director, Dr. Pisati, the staff at the office and the conference planning committee, thank you very, very much. Our conference volunteers and the conference team, thank you for it. Very well done. Thank you for your tireless year's conference, the first of its nature. Goes smoothly. I want to thank our outgoing Executive Director, Dr. Chrisati. Unfortunately, informs me that he has a bad cold, so he will not be able to say farewell, or as we say in this part of the world, Asante ya kuona. But his heart is with us, and I am sure he will continue to be there for AfHEA all the time, as he has always been. And of course, finally, I want to welcome our incoming Executive Director, John. John, you are most welcome to the family of which you have been part. I think you will continue doing a great job. You've been in charge of our capacity building, and I'm sure that to end my vote of thanks, I want to invite us all to a 10 minutes video that pays tribute to our outgoing Executive Director, Dr. Chrisati.
He is internationally recognized for his stellar performance and leadership as the founding Executive Director of the African Health, Economics and Policy Association. He has been responsible for the overall performance and organizational effectiveness of AfHEA for over 12 years. He's an outstanding health economist who has over 25 years of experience and holds a PhD in development studies, economic thesis from the University of Sussex. He is currently working on health system financing worldwide with R4D as a senior program director responsible for health systems and financing work in Ghana and Nigeria. He also worked with the World Bank, PATH Malaria Vaccine Initiative in Geneva, the HLSP Initiative in London, ABT Associates, the Belgian government on health schemes, and the ILO in Senegal. He was also an associate professor in health economics with specialties in health insurance and health policy at the Institute for Higher Management Studies in Senegal. Other notable feats include research and activities that have propelled the growth and viability of the NHIS throughout West Africa and even as far as Rwanda. Ladies and gentlemen, celebrating Dr. Chris Atin.
Hello, Dr. Chris. congratulations, or parabéns in Portuguese, for successfully completing your tenure as the founding executive director of AfHEA. From the depth of our hearts, we want to thank you for all that you have done, the sacrifices, the sleepless nights, the great work you have done to get AfHEA running for these past 12 years. It's an amazing thing to really say of you, and we want to thank you for being an exemplary leader, someone who has dedicated his life to improving health outcomes in Africa through extension of financial risk protection to our citizens across the different parts of Africa. We want to thank you, and we pray that, Lord, you will continue to support AfHEA even though you have rounded up, and we really will miss you as executive director for sure, and I've also learned so much from you. Thank you for being a mentor, an exemplary leader, and may God bless you. Thank you.
Bonjour Chris et salut. Félicitations. Et malgré le fait que je n'ai pas eu l'opportunité de travailler pour longtemps avec vous, j'aimerais vous féliciter et vous remercier pour votre travail pour l'association. J'espère que vous avez eu merci pour le bon travail que vous avez fait pour l'association, et j'aimerais vous souhaiter votre bon courage pour votre activité que vous avez dans le futur. Merci bien et bon courage. Au revoir.
Right from the moment that he gets here, and right from the moment that he's speaking, this drive and this passion to see the association succeed comes across. I'm really grateful, Seth, for seeing that glimpse, seeing that passion, seeing that drive, because it also trickles down into how you would like to see the association run, and especially in terms of operations. So beyond this moment, I know that this is not the end. We definitely will be seeing you. We'll definitely be coming to you for a lot of advice, a lot of direction, a lot of guidance. And I want to take this opportunity to say thank you so much for all your sacrifices to AfHEA. And I just want to say congratulations.
I want to use this opportunity to say thank you for the impact you have made on me as a person, and in fact on AfHEA as an association. I met you in 2016, and since then I've closely worked with you at AfHEA, first as a research assistant, and now as a program officer. And I've learned so much from you over the years.
This is my thank you message to outgoing Executive Director, Dr. Chris Atem, for his excellent support to finance and admin section of AfHEA. Chris's leadership throughout the years have been one that offers opportunities for growth and achieving results, especially in relation to finance and administration. That is, aspects of being accountable to donors, securing AfHEA's financial future, planning, auditing, coordinating, controls, productive decision-making concerning resource allocation, fund raising, and policies and procedures which relate to all aspects and achievement of AfHEA's set of financial goals and objectives. Through your active engagement in office affairs, tireless work, inspiration, and exemplary leadership. You have provided us with consistent opportunities to grow and learn as professionals. Fond memories and experiences are what we have gained from organizing the scientific conferences to learning new skills, having wonderful experiences, and achieving AfHEA's goal. I would like to express my deepest gratitude for your leadership and mentorship. We wish you the best of luck and we'll miss you so much. May God keep you safe and bless you. Thank you.
Good afternoon, good evening, good morning, colleagues. This is Logan Brenzel from the Bill and Melinda Gates Foundation, and we want to thank and recognize Chris Ateem for his vision and partnership with us on the African Health Economics Association since its inception over the past 10 years. This has been a fruitful, productive, and important journey together to support and strengthen health economics and policy research on the African continent, and particularly for bringing the work of health economists, analysts, and policymakers closer together in a series of very successful AfHEA conferences. Chris has been a tireless leader in this effort, and we truly appreciate all that he has done. We look forward to the next conference in a few days and towards the bright future of AfHEA in the coming years. Cheers to my friend and colleague, Chris.
Hi, Chris. When you first, many years ago, chatted to me about the vision you had for a regional association, I thought you were completely crazy. It felt to me like it was unachievable. But you have achieved it, and I marvel at your energy and commitment. And I know that health economics in Africa would not be where it is without your efforts and without AfHEA. And just briefly, as AfHEA Executive Director at the moment, it's really important to recognize that AfHEA is the only truly regional member-based health economics association, with members from the south and the north, from the west and the east of Africa. It is really an amazing example for the rest of the world and something you should be very proud of. It's very sad to see you leave your leadership role in AfHEA, but you have built a very strong foundation on which others can build. And AfHEA will provide whatever support we can as AfHEA enters this new phase. On a personal note, it's been an absolute privilege and an honor to work with you, and I know that your legacy will live on in this amazing continent that we live and work in.
Dear Chairperson of the Board of Trustees of the African Health Economics Association, dear Chairperson of the Board of Directors of the International Health Economics Association, dear outgoing Executive Director of the African Health Economics Association, Dr. Chris Ateem, dear the newly appointed Executive Director of the African Health Economics Association, Professor John Ataguba, dear partners, representative of African Health Economics and Policy Association, distinguished guests, dear participants, first of all, kindly receive my greetings from Rwanda, the country of 1,000 hills. I would like to start by extending our sincere appreciation to the African Health Economics Association for having chosen Rwanda as the organizing country of the 6th African Health Economics Association Scientific Conference. Although it was not possible to have the conference physically due to the impact of COVID-19 pandemic that we are all aware of, I believe the main objective of the conference was achieved. If Rwanda is to physically host the next conference post-COVID-19,
we shall get the opportunity to offer you all our best hospitality and be able to extend the network. Today marks the end of the fruitful 5-day conference that culminated in rich discussion around the theme towards resilient health systems in Africa, the role of health economic and policy research. The main theme of this scientific conference, as well as the subsequent themes, are timely considering the health crisis that the world and Africa in particular is facing. The sub-theme cover all the important issues that our countries should critically consider in order to strengthen our health systems. In order to ensure health security and continuity of health services during normal time, during the pandemic, during other shocks. Evidence from policy research are very important in building resilient health systems. Health economics evidence are of utmost relevance. Most of African countries operate with limited financial and non-financial resources. There is therefore a high need to allocate and spend the available resources efficiently to ensure health services are provided consistently. Everyone needs a decent health care. The element of equity that aims at leaving no one behind should be stressed more if we want to reach the global and continental health-related goals, including the universal health coverage by 2030 put forward in SDGs. All this has been discussed in detail along the 5 days. Allow me to share some key strategic choices that Rwanda has made in our journey towards building a resilient health system. Since the last 2 decades, the government of Rwanda has continuously strengthened the primary healthcare system by decentralizing the provision of healthcare services closer to the community, by establishing strong network of community health workers in every village, making health services financially accessible to everyone by establishing strong financial protective mechanisms such as community-based health insurance scheme, commonly known as CBHI, that covers 90% of the population. The CBHI has ascertained that individual and household financial protection are assured while assessing health services they need. As a result, health services prioritization has increased for the past 20 years and reached about 1.5 per capita per year. Like other African countries, our health systems and health sector have been also challenged by COVID-19 pandemic, both in terms of morbidity and mortality. However, the magnitude remains relatively low due to the fact that the country has opted for evidence-based preparedness and response measures. All this shows the importance of evidence-based decision in healthcare management. I believe African Health Economics and Policy Association can support more of African countries in this area. Distinguished guests, ladies and gentlemen, in Rwanda, we are very committed to using evidences to inform policymaking and practice. We promote and support capacity building for our current and future researchers. Given various themes discussed in this conference, I believe that the Minister of Health shall continue technical discussions after the conference and find ways of cooperation between the Minister of Health and AfHEA for capacity building and knowledge exchange. I urge participants to this conference to use the gray materials gained for this scientific conference to inform and influence policy decision-making and implementation processes in their respective settings. Let me also use this occasion to make a call to decision makers to seize the available opportunities the COVID-19 pandemic has brought to make our health system in Africa more resilient than ever. The end of the conference should not mark the end of our interactions, but rather the beginning of the policy dialogue and development for Africa-grown solutions to African health problems. I'd like to end by thanking again the AfHEA leadership for considering Rwanda as the host of the conference and welcome you physically to Rwanda in the near future. With this note, I'm pleased to officially declare the conference closed. I thank you for your kind attention.